Hi friends, myself Dr. V.S. Rathore. I am an aesthetic plastic surgeon. Today I will be telling you about a gynecomastia or a male boob problem. This young patient of 32 years is having a bilateral gynecomastia. Left side is bigger than as compared to the right side. And as per him, he has this problem during adolescent when he was studying in class 9. He used to feel very ridicule, bit less confident, and not able to wear the proper garments. Now what he has noticed for last 1 year, he is having some trouble, pain and discomfort on the left side. As per he feels some vibration sensations on the left side of the gland, and at times he feels some granularity on the left side. You can see this one is the left gland, which is definitely a bigger as compared to the right side, and this one is a gland on the right side. Please just press hard. You can see these are his pectorals. This is the pectoral border, and I'll be using an axillary port so that the scar is hidden, and the gland I'll remove from infra-areolar incision. This is the gland which is palpable, and this gland is definitely bigger. So anyone having a gynecomastia problem or a male boob problem, the best treatment which will provide you the 100% cure is to do a liposuction and a gland excision. I do this surgery in a local anesthesia, which is a tumescent infiltration anesthesia. The patient is fully conscious, and as soon as the operation is over, patient can inspect his gynecomastia area. If some residual fat or gland is there, we'll remove the things at that very time, so that in follow-up there is no problem to the patients. So stay connected with me. You can follow me on Instagram, you can like my Facebook page. Please subscribe my YouTube channel in the name of Kaayakalp. So hi, you can see the liposuction is complete. This is how you can make out the suction is complete, and you can see this is the visible bulge. That's the gland. I can hold in between my fingers. And now what I have to do, just make a infra-areolar cut, and you will see the gland start popping out. So first step is to separate the nipple areola from the gland. You can see, just leave it. You can see the gland is separate, and that's the gland. Just provide a gradual traction and start separating the gland from the surrounding attachments. There are three parts of the gland: head, body and tail. All the three parts one must remove in order to have a complete treatment. That's the gland which has been removed.